Let me teach you how to perform cannulation in medical school in under 60 seconds. So you first start off by gathering all your equipment, your flush, cannula, wipe, tourniquet, and make sure you have a sharp spin nearby. Step number 2, you apply a tourniquet and palpate for a suitable vein. This should feel bouncy underneath your skin. Step number 3, you clean the site using the chlorhexidine wipe. And then you prepare your cannula and you insert it while anchoring the skin at a 15 to 30 degree angle. Once you see that flashback, you advance the cannula all the way in. And depending on the cannula type that you may have, you close the clamp and apply a bung. You may need gauze because it can get messy sometimes. Step number 7, you secure the cannula with the tape on both sides. And number 8, you remove the tourniquet. You then prepare and flush the vein using 0.9% sodium chloride, and you can see the blood in the cannula being flushed away. Number 10, you then apply the dressing, and it's super important that you can actually see the cannula site through the dressing. You then write the date and time of when you applied the cannula and write it in the notes.